Hello everyone, we chose to do our presentation on telehealth nursing. Telehealth involves electronic and telecommunications technologies that provide nursing care across a distance, empowering the care providers with the ability to monitor, educate, follow up, collect data, and provide multidisciplinary care, including remote interventions, pain management, and family support. It helps to manage chronic conditions and prevent readmissions. It provides care coordination, providing access to homebound patients, patients who live in rural or underserved areas, and other issues that limit their access to care. It gives patients that may have rare medical disorders an opportunity to obtain care. The U.S. Department of Health and Human Services is waiving penalties for HIPAA confidentiality violations by healthcare providers for telemedicine visits using non-encrypted technologies such as FaceTime or Skype during the COVID-19 crisis to make healthcare more accessible and safe. There are many benefits related to telehealth, such as increased access to healthcare, the ability to diagnose, monitor, and treat remotely. Patients from rural areas can see a provider more easily. Specialists are more available and don't need to travel to see a cardiologist or neurologist. Interprofessional care. Providers can more easily collaborate for medically complex patients. There is an increased patient satisfaction. It is convenient and more efficient. No more waiting in an office, no need to leave the house, and no need to arrange transportation, childcare. And it is cost-effective for both the patients and the providers. There are also risks involved with telehealth, such as privacy and confidentiality. Are there other people in the room and you just cannot see them? Can people see your information on their screens? Malpractice, such as technical glitches, causing injury or misdiagnosis. Requires competency for optimal healthcare delivery. Van et al. Found that nurse education in telehealth services helped to increase nurses' knowledge of telehealth, their self-efficacy, and increase the usage of telehealth services. There are many things involved with the safety of telehealth, such as don't have to worry about commuting for the patients to the facilities. It is especially useful for those that do not have access to transportation and the elderly. There is a less patient and provider exposure. COVID-19, we went from fewer than 500 billable televisits in February 2020 to nearly 55,400 in March of 2020, and then to nearly 83,000 in April of 2020. That shows that 138,400 less face-to-face exposures in just 2 months. This will also help to reduce the usage of PPE in our hospitals and clinics. Telehealth technologies for remote health home care and digital monitoring devices help to increase safety for elderly living independently. Examples are video phones, message services, biometric devices, digital cameras, and telemonitoring devices. Telehealth aids in efficacy in many ways. It provides virtual modalities for chronic disease patient education showed to be comparable or more effective than conventional approaches. Research by Karlberg showed telehealth services to be very effective in reducing emergency department length of stay, preserving personal protective equipment for staff, and decreasing patient and provider exposure during a hospital outbreak of COVID-19. In the study, 153 patients out of 300 were successfully discharged by a telehealth provider and showed a 62.5% shorter ED length of stay and saved over 413 sets of PPE for staff. In 1997, the World Health Organization stated telehealth should be available to all people, as it has been shown that telehealth encounters between patient and providers were as effective as face-to-face office appointments. 2 qualitative studies of patients with IBS being treated by telehealth services showed participants believed telehealth provided them with increased knowledge about IBD and symptoms, improved two-way communication between patients and providers, a sense of reassurance, and better appointment options. Cost analysis of telehealth. Telehealth is shown to reduce costs to the health system in the short to medium term, primarily by reducing health-funded travel when either patient or clinician travel time was shortened or eliminated. It is great for rural or other remote areas. Telemonitoring offers some savings in lieu of home visits, reduced salaries of home visit nurses, and reduced numbers of hospitalizations. It improves overall health and reduces morbidity. It works well for high-risk pregnancy monitoring to reduce need for in-hospital monitoring. Teletriage saves costs by reducing the number of unnecessary hospital visits. Telehealth is also shown to be not cost-effective. Cost of setup and running telehealth is expensive until threshold or break-even point is reached, which varies and with each practice or institution and may be years. The fear that system may be overused because of convenience, which will increase health system spending. And health services considering telehealth implementation should be motivated by benefits other than cost reduction. Legal analysis of telehealth. Telehealth encounters are more vulnerable to privacy and security risk than in-person visits. This involves HIPAA, the Health Insurance Portability and Accountability Act. Platforms need to be highly encrypted to be in accordance with HIPAA. The Ryan-Haidt Online Pharmacy Consumer Protection Act of 2009. It prohibits online form-only prescribing of controlled substances and mandates that online prescribing of controlled substances can only be done once and an in-person medical evaluation of the patient has been completed. Health information technology for economic and clinical health requires data breach notification for unauthorized uses and disclosure of unsecured or unencrypted PHI. Some implications for nurses is it gives the nurses the ability to monitor more patients and continue to monitor them without being present. It gives nurses more freedom and flexibility throughout the day, and you don't have to practice in the same state or area as you are monitoring. In conclusion, the use of telehealth technologies has grown exponentially since the beginning of the COVID pandemic. It is very beneficial to patients, with few drawbacks evident. Patients enjoy less driving and waiting time, easier consults, fewer hospital visits, and even lower bills. Can be costly to healthcare systems for initial setup of technology, but benefits to patients outweigh monetary costs. Especially beneficial for patients living with chronic diseases, those in remote areas, and during times of pandemics. The concerns with HIPAA and malpractice are justified. Certain to be a bigger part of nursing in the future, nurses will need special training to become telehealth nurses.